Hi there, I'm Andy Larson. I am a nurse practitioner coming to you from Iowa. I actually work in cardiology, and we are going to talk a little bit about how blood work is actually a really great way to go ahead and look at whether you are aging well on the inside or if you're potentially older than your biological age. So metabolic health does not just mean that you're happy with the number on the scale or your genes are fitting the way that you want them to. Metabolic health actually really looks at how well your organs are functioning at a cellular level. So really, since the ancient Greeks, we have used analysis of human body fluid as a way to understand health conditions and disease. And lab work is not only just something that we use as a diagnostic tool, but it's really something that we use to risk stratify patients. And that means we look at blood work as a patient ages and look at trends to determine what is somebody's risk of developing something like cardiovascular disease, right? So the very first lab opened in the United States in 1896 at Johns Hopkins University. And since then, we have had this explosion of blood tests that we can use to diagnose patients with particular conditions or determine whether or not a patient is at higher risk for developing particular chronic diseases. So some of the more common labs that we use on a day-to-day basis are what's called a complete metabolic panel, or a CMP. And this, of course, looks at your kidney functions, your electrolytes, how your liver is functioning, and even what your blood glucose level is. Then we use something called a CBC. This basically looks at your blood counts. So are your platelets functioning normally? Do you have enough hemoglobin? This looks at all the different phases of the blood cells and whether they're mature or immature, you're not making enough, our white blood cell count, all these different factors. We look at patients' urine, and sometimes we even do genetic testing depending on things that may run in a family or specific concerns that we may have about a patient's risk of developing a particular condition. So we know that as we get older, our organs are aging, and so we actually see age-appropriate changes with some lab work. And I'll go ahead and list some of those in the paragraph below. But the important thing to know is getting lab work helps us physically see that we are younger on the inside maybe than our biological age. So maybe we're doing a really great job of taking care of our blood counts by making sure that our gastrointestinal tract is healthy so we can adequately absorb the iron that we're eating, the iron that our bone marrow needs to be able to make hemoglobin, okay? Something else could be a PSA for a man. So we know that 70% of men over the age of 70 have some degree of prostate cancer. Whether that prostate cancer will be what ultimately leads to their demise is probably pretty low. But, trending those PSA levels as we get older, when we're doing something like using the MetaPower system to specifically target healthy cell aging. In the next few days, we'll go ahead and break down some of these specific labs so that you can go ahead and feel confident when you're looking at your lab results in understanding some of the basics of what they mean.